possible. We are here to talk about protection risks, not in theory, but in a very real sense of harm, whether through violence, forced displacement, denial of basic rights. Addressing these risks is not optional. It's a core humanitarian responsibility. In today's constrained funding landscape, we're being asked to continue doing the same, I won't say more, but with much less. That means that we must sharpen our focus on the places where protection risks are greatest and where humanitarian needs are also more acute. This is about a smarter prioritization, but more than that is about embedding protection at the heart of humanitarian action, because we know where people's rights are violated, humanitarian needs follow. Protection risk analysis help us to do this better. It's not just an enabler, it's essential. And even in a constrained environment, it's doable. The GPC and our partners, we are working together to simplify and scale collective approaches that leave no one behind. Identifying also the critical protection risks is a first critical step to make sure the rollout of the centrality of protection, which is at the end our main goal. But this demands a joint up action. We need donors, agencies, and sectors working together with communities to embed protection into every part of the response. I think a key question for this panel is also, what do non-protection actors need to make risk analysis more simpler and actionable across sectors, and how they can build on the protection risk analysis? Because this is how we ensure protection is built into humanitarian response, no bolt-on. With that, I'm pleased to hand over to Ambassador Dominique Steelhart, Deputy Director General and Head of the Swiss Humanitarian Aid. Ambassador, thank you for being with us and for your continued support to the protection cluster.
Thank you very much. Good afternoon to all of you. This is a very intimate setting, so I hope we will have a good conversation afterwards. Can everybody close their microphones, please? Thank you very much. So first of all, I'm really pleased to be here today. We, the Swiss Development Corporation, have for a long time strongly supported protection activities. And I feel that, or we know that we are at a turning point. The humanitarian sector is at a turning point. And all organizations are now struggling. Many organizations are struggling. Some will perhaps even disappear. Country humanitarian resident and humanitarian coordinators, they've been asked to lead a prioritization exercise. And my concern or my fear is that when we say life-saving activities, protection is kind of not on top of the priority list of countries, humanitarian resident and humanitarian and resident coordinators, and therefore we will see we may see a significant weakening of protection action because of the situation in which we are finding ourselves today. And yet, this is a paradoxical situation, because if there is one activity that is helping to shrink needs, it is protection. It is protection, which, if there is a better respect for the basic rules of international humanitarian law, there is the perspective of a significant reduction of humanitarian needs, and that is why it is absolutely crucial that collectively, when we are now going through this prioritization exercise, we don't think of protection as a nice to have activity. And that is also why we, Switzerland, with a number of other donors, are leaning on the system, the JASC principles, among others, to try to influence some of these choices. I cannot say to ensure that protection, because it's not for us to ensure, but what we can do and what we are doing is we are influencing, we are trying to influence some of the choices that are now being made as we speak, by the way, as we speak. In humanitarian crisis, Switzerland works actually in three different roles. We are donor, but we are also actor and we are advocate. That is the way we are thinking of our role in humanitarian settings. And the joint protection risk analysis is essential for all three of these roles. As a donor, we can draw on the protection risk analysis to make funding decisions, guide donors where support is most, and to guide donors where support is most urgently needed. As an actor, we can contribute to the analysis and then pick up on key risks identified that may be beyond the humanitarian community to address. And here it's again upholding international humanitarian law, engaging with conflict parties behind the scenes, negotiating access, and so on and so forth. And as Switzerland has the advantage of having a relatively broad diplomatic network, that even under financial pressure, we have made a very clear decision that we want to maintain. We are not closing embassies, we are not closing our representations in the countries where we are. In many of these countries, especially, of course, crisis-affected countries, our diplomatic representations, they are engaging in these conversations on upholding international humanitarian law. And in order to do so, a sound protection risk analysis is, of course, absolutely crucial because it helps us also to see where is it, what sort of conversations we should have with governments and at times also other warring parties. And then, as an advocate, we can, of course, draw on the information in the analysis for our advocacy and multilateral forums, where we are obviously also very present. So we look to the humanitarian and resident coordinators to provide leadership for the centrality of protection. And the joint protection risk analysis is a pivotal first step to bring humanitarian partners, humanitarian leadership, and the donor community together. I do believe that donors should actually be engaged in the analysis and strategy process from the beginning to ensure that they can best contribute to collective efforts with their capacities. This would also allow the donor community to support humanitarian actors in acting on this joint analysis that is so important. As humanitarian teams across the globe are now revising their humanitarian response plans, they are identifying priorities and making what are essentially impossible choices that will have severe impacts on affected communities. And I hope that this session can be instrumental in showcasing how protection risk analysis can be a powerful tool to bring humanitarian partners together and to steer the collective thinking across towards a collective approach to reduce needs, as I said at the beginning. I just also would like to take this opportunity once again to perhaps make the link to the efforts in the protection donor group. I don't know whether how much you are familiar with the protection donor group. This is a group of 11 donors that have joined forces to strengthen the centrality of protection in humanitarian action, and we are and we are we have now we are co-initiators, so to speak, of this group, and the idea is also that this group together can influence now some of the choices that are being taken. We have really some of the most important donors that are sitting on this protection donor group, and we are not just asking, for instance, humanitarian and resident coordinators to assume leadership for what we think is a collective responsibility, and not just should not be left to a cluster, to a technical cluster. The whole protection activity, the protection approach is a collective, should be a collective responsibility of all humanitarian actors, and not yet another technical thing that we are doing. It is something that we have to do together and keep in mind all the time. That's why we are talking about the centrality of protection. And we have also reflected on how can we be useful as a protection donor group, except from asking and advocating and telling the humanitarian and resident coordinators they should assume responsibility. They should assume responsibility for plenty of things, but of course we think they should mostly assume responsibility for protection. But you see the problem. Everybody is leaning on them to assume responsibility for plenty of other things too. So that is also why we said, look, we are asking you to assume responsibility for protection, but we are also ready to support, to provide specific, dedicated support for you to assume this responsibility in a meaningful way. And that support comes, of course, can come through money, but we were mainly thinking of seconding protection people to the offices of the humanitarian and resident coordinators in 2-3 countries, where we could perhaps really strengthen the protection action led out of the office of the humanitarian and resident coordinator. These discussions are ongoing. They have not been made easier now with the crisis that we are facing, but we are determined to maintain that conversation and to really see how we can meaningfully support protection action, including, of course, a protection risk analysis in relevant countries. With this, once again, thank you for having me. I'm happy to be here, and I'm looking forward to the conversation.
Thank you very much, Ambassador. We'll now pass the floor to Francesco Michele, who is Strategic Analysis Officer in the World Protection Cluster, and he will talk us about opportunities on protection risk analysis for collective action. Floor is yours.
Thank you very much, Pep, and thank you very much, Mr. Ambassador. Can you hear me well? Yeah. Sorry? It's not online. Sorry, colleagues. Just let me fix the technical part. Now it's online. Yeah. Sorry for that. Thank you very much. Thank you very much for, it's really reassuring to hear that protection is central and it should be a collective responsibility. And I'm Francesco Michele, supporting on analysis. And on my side, I wanted just to focus a bit on looking at the efforts that Protection Cluster with AOR partners and also colleague of Ocean Agency has been doing in the past years that can be actually helpful for the collective actions. So I will not focus on the work on protection risk analysis that we did for contributing to protection activity in the cluster, but more what can be an opportunity that we can leverage upon. I will focus on 3 general areas of work, a bit the work that we did in defining what a protection risk is analytically as compared to a humanitarian protection need, which is an important differentiation. And then sharing a bit on the processes that will be put in place that can be explored as an opportunities. And then I will just land on a bit of some few words on the possible guidance that is available to all partners. First of all, in last years, as you can see, I mean, from the slides, the process has been not just a recent one, but we have been investing with partners and so on in the last 4 years in many piecemeal steps with one objective in mind, defining very clearly analytically what a protection risk is. Because at the level of the humanitarian coordination, of course, we focus on needs, and sometimes probably we have been conflating a bit our analysis between risks and needs, so that has been our primary objective. This simple slide, it basically then encompasses the work of partners, AOR, not just within the cluster, but also as individual agencies. So there's been a very important collective efforts within and beyond the protection sector, I would say. When it comes from defining analytically the difference between what a protection risk and a protection need is, again, this is a simple slide, but on the protection risks, I will not delve too much. But basically, because there is a IAS definition that we all know, but it's how people is exposed to violence, coercion, and deprivation, as a different from how that exposure results in humanitarian need. So that's a clear difference. So for us, at least at the level of cluster, we have been defining that the protection needs of people, the humanitarian protection needs, are an effect of that exposure to protection risks. I think it was clear to many of us, and also as it's very clearly stated in the IASC, but probably analytically, we have never been addressing that very strongly, and that's a bit the main effort that we've been doing in past years. What does it mean in practice? As we know, in humanitarian crisis, we have the people affected and then a subset of population that is the people in need. That's the way we work when we work on HNRPs, on general humanitarian planning. What we've been introducing in specifically last year is a middle layer where we calculate and analyze how many people is exposed to risks, which is a fundamental difference, and that can help us, can give us many opportunities. So it's an analysis that we introduced just last year, so we didn't explore the full set of opportunities, but now we have those elements that we can build upon. As you can see in the slide, at the moment, the work that we've been doing with partners in AOR and so on is available in 3 different forms. We have specific data that look at the severity of 15 protection risk at subnational level, so we can be leveraged upon in the prioritization exercise, and we have this ongoing dialogue with OCHA colleagues. In countries, all the efforts, knowledge of partners is encompassed in the identification of priority risks that should be addressed collectively. That again, addressing them is not a responsibility of the cluster of protection partner, but at least that's a sort of service that we put forward in order to trigger a bit the advocacy and other general programming can be done around that. And lately, from last year, we calculate the exact number. We calculate the number of people it's at risks. Of course, building in our analysis of severity. Those are all opportunities that can be exploited beyond the protection cluster and protection cluster activity. Beyond numbers and beyond the analytical approach, already we have been looking very extensively in how to maximize existing data. So how can we do that without recreating parallel mechanism and use the available data and information that is out there from multiple sectors? Second, how can we leverage much more onto the observation, the knowledge of frontline colleagues, partners, communities, and so on. So sometimes the work on humanitarian field is very data-oriented and it's very data-heavy, but we don't factor in very well the real situation that is actually in the view of our frontline colleagues. So we have been looking into our analytical approach to encompass that much better. And I will not delve into the slide, but in the slide you can see 4 general exercises that we have in place that can be leveraged upon. On the harmonization of data, I will use a very simple example just to go there, but a couple of questions on opportunities that we have there. How can we use the join up analysis that we do to actually bring better, as mentioned, donor, that's a great suggestion. How can we do that? What can be helpful for that? But also other partner, but more specifically communities and local level. That's a question that we kind of face all of us together. And the other one, we have been having recent conversation, how we can leverage upon the qualitative part, the understanding of situation. Oftentimes, the worst protection situation is where we don't have access. So how we can bring that in. So now I wanted to show just 3 examples, just to trigger a bit the opportunity conversation, and then the colleagues, panelists from OCHA, WFP, and ISC will continue a bit on the exemplification. On the data side, I didn't want to do a complex slide. So just to show you that basically the exercise that we've been doing, we've been looking at multi-sector information. So here you can see some examples of mechanism in place, and try to find a way to organize them better to understand both risks but then the core components of risk. Of course, we use the path, so which is related to the threats, the effect, and capacity, but related to those elements. What does it mean? And here we have a very simple, nice animation. So it's basically, we are like the system that we have in place, we have the opportunities to already use existing data and information to other sector to provide an account on specific risks. This is something that we have been exploring internally for our analysis with our co-partner, but I think that, and we have already ongoing conversation with MSNA or other sectors in some countries, but I think that there is more we can do in this direction. On a different venue, in terms of examples, here I wanted to present an example from Northwest Syria, and it's interesting because here is not a huge exercise of joint analysis workshops and so on, but it's a very simple exercise whereby protection risk has been used for the identification and targeting of households for food security assistance, which is extremely interesting in itself. On the side of the protection cluster, the tool is quite simple because it's based on observation and partners presence. So where we have partners. So the partners, the protection partners, using the protection risk and some of the criteria that we have been establishing, they identify along their own protection activities households with specific criteria that might be in need of food assistance. That information then is passed on to food security partner and WFP, and then of course then food security partner and WFP, they run their own specific food security assessment to register households for food assistance. This I think it's a fairly simple example, but it worked well. The number you see there is of all 2024 and 2025. So we managed to find 5,100 households registered for food assistance through protection partner. So that I think is also an interesting exercise of collaboration. On a different level, that it links more with what I would say the ideal approach on how we can operationalize centrality of protection. In Venezuela, the protection cluster has been carrying out different joint analysis workshops at a national level to do the exercise that we have been discussed, before, severity, prioritization, and so on. What has been interesting is that there has been several workshops at the level of the inter-cluster coordination group on the same analysis to include inputs, and to use those inputs for the protection analysis update from the cluster. But on the second phase, that actually inform the allocation of the reserve of the ZPPF to protection. But as you can see from the simple list I put on the slide, it was not just protection activity. There was a collaboration between, here you can see WASH, food security, nutrition, and shelter, but also I know that there was also education and so on, that identified different activities to address protection risks, the protection risk prioritized. This initial exercise on the CBPF allocation then has been informing the crafting of the HNRP. So in the HNRP, there has been the development of a specific objective on protection that did include not only, at least it's nice to hear a kid. It included a specific objective of protection that did not include just protection activity, but include multi-sector activity to address protection risk agreed together. And what is interesting that is happening right now is that in the current reprioritization, all that joint collaboration is helping the current reprioritizations, whereby protection and nutrition has been defined as priority area, but not as a sector of activities, but actually to identify multi-sector activity to address protection. Again, for me, it's sort of the ideal approach, but I wanted to show because that's something that came from the collaboration on the ground, and I think we can exploit this much more, as some of our colleagues from OCHA will delve into. I'm done with examples, so I will just spend 2 minutes. From the cluster side, I think that we have been trying to clarify a lot of elements to be better in protection risk analysis for the collective. And just to say that in terms of the guidance that has been developed in the last year and a half, there are 2 elements that might be interesting to explore more. One is on the dialogue with other, I call them system. So sometimes it's a matter of language. So humanitarian with development actors, with the sustainable development agenda and so on. Sometimes it's a matter of language. So we've been working in linking better protection risk with human rights, with durable solution and other elements. But also on the data interoperability, which is probably one major question moving forward in the humanitarian reset, that we have to seek more how to do it. We have been working a bit better in not just to look at our protection data, but at the multi-sector data. So I will just conclude there. Just a bit of some inputs for the opportunity in the Q&A, and thank you very much. And over to you, Pep. Thanks.
Thank you very much, Francesco, also for bringing practical experiences like Syria and Venezuela to see how does it work in practice, and more important, also the link with the centrality of protection.
Can I ask a question, or is it not?
It was more for the Q&As, but being you, please go ahead.
Go ahead. Sorry. It's good to disrupt a little bit the proceedings. Now, Francesco, I listened very carefully to your presentation. But what is your main message? What is it that you want to tell us with what you just presented?
But this was not scripted, that's all. One is, I think that you conveyed, even though many of the effort to be better in protection risk analysis have been housed in the GPC, all of that knowledge and all of that elements of analysis, I think we have to use them better for the intersectoral collecting, and we don't know exactly how. So that's a conversation we have to move forward. And the second is, beyond the generalization, I don't know, it's a good word about centrality protection and protection risks, even if some of the analysis we have are not perfect, I think they could be a good starting point. So that's probably, I will stop there, not just to.
Okay, and then I will stop, don't worry. Do I hear a slight frustration that some of the available data and analysis is insufficiently used by the system? Is that what I'm hearing?
No frustration, and actually after me, my colleague Natini from OCHA will speak, is that we started already that dialogue. And not sufficient use was not because of frustration, but because on our side, we introduced all this analysis last year. So it's really recent. So the first type of analysis we had it in November and December. We started the dialogues already with colleagues of OCHA, and the idea was to continue the dialogue this year. So it's not frustration because of any purpose barrier on it, but because it's very early. So now I think that in the current conversation of the reset, is important and interesting to maintain and maybe to accelerate that dialogue. That maybe would be my message.
And on this, I think that we have seen during the last year many of the countries producing a very complete protection risk analysis, very good analysis, very good and comprehensive narrative analysis with the clear identification of 3, 4, 5 critical protection risks in each operation with a set of recommendations. But then also, I think what we need to further discuss and be more operational and find responses in how this protection risk analysis also brings to collective action, how the other non-protection sectors can also enrich this analysis, and how we can use this also to push for collective actions in the country teams. It's good that we have a risk analysis. It's good that guides the protection cluster response. But I mean, at the end, the centrality of protection response, it has to come for the overall system, not only for the protection cluster. I think that's a critical element for the discussion and to have an impact thanks to this analysis. Because if not, we end up with analysis and that's not enough. I mean, what we want is that this analysis provokes and moves to collective response. Having said this, we'll have more debate, I'm sure, in the Q&As. So we move to Katie Grant from IRC and Andrea from WFP. Not in my last. So for OCHA first.
Natini, are you online? Natini, maybe your mic is off. Sorry, technical issue.
Hi, can you hear me?
Now, yes, perfectly.
Sorry, and suddenly my camera is not working. Apologies. I leave it on. Once it's on, it's on. So thank you so much for the floor, and thank you so much, Francisco, risk analysis. As you mentioned, we've been working together with the protection global protection clusters, also to utilize the good work that you did as part of the joint and intersectoral analysis. So for my intervention, I'll be focusing on two parts. One is how the protection analysis that Francesco just walked us through contribute to the GR, the joy, and as this is the ISC endorsed methodology that used for the estimation of humanitarian needs in the country to inform the HPC, the humanitarian program cycle. And then the second part I will touch upon how this result linked to the ongoing reprioritization exercise that is happening at the country level. All right, so just to step back a little bit, looking at how protection analysis feed into the GF. So the protection is reflected in several parts of the overall intersectoral analysis framework that we have, starting from contribution as a cluster, as a sector. And because of this is the foundation of the GF, because it's based on the contribution or the analysis done at the cluster level that inform the intersectoral need analysis. So all of the cluster or sector input will be used to inform the intersectoral part of the GF. So this is one part, the protection contributing to the GF. Next, please. And in addition to that, I think protection is clearly reflected in the ISC definition of people in need as written on the slide. You can see that when we talk about people in need, these are defined as those members whose physical security, basic rights, dignity, living conditions, and livelihood are threatened or have been disrupted. And in addition to the definition, it's also integrated into the operational guidance of the GF in terms of the definition of what constitute a humanitarian need in the country. So this is another piece that protection contributing to the GF. Next slide, please. And last but not least, this is very important. So we have this, what we call humanitarian outcome indicators. There are three groups of indicators that are intersectoral and the standardized indicators, and also class threshold, and also description of those indicators. So as you can see that, protection has a place in this as one of the three outcome indicator groups that are used to define severity of needs and also highlighting catastrophic situation. And this is based on the human rights violation, IHL violation, that will cause the irreversible harm to people and property. So we use this as a reality check of the sectoral analysis and also intersectoral needs analysis. Next, please. And as I mentioned, the GF, every country that did the humanitarian program cycle used the GF for the estimation of humanitarian needs in the country. And based on that, it's aggregated at the global level, and that feed into the global humanitarian overview. And in 2025, we estimated about 307 million people in need of humanitarian assistance and protection services. And out of that, 185 million people targeted. And to do so, we require $44 million for it. And this is also linked to the financial tracking system that we, as of yesterday morning, we track about 2.78 billion received for the humanitarian response this year. Next, please. All right, so those are part of how the linkages between protection analysis contributing to the GF. And now moving on to the ongoing reprioritization. So as you are aware, because of the current landscape that we are in, the Emergency Relief Coordinator has asked humanitarian coordinator in every country to urgently consult with the country team to re-strategize or reprioritize urgent life-saving actions. And this built upon the good work that was done as part of 2025 humanitarian program cycle. And this reprioritization exercise is actually one of the 10 actions that the ERC, the Emergency Relief Coordinator, outlined as part of the humanitarian reset, which are based on 3 strategic priorities. And I put the link there in case anyone of you have any one of you haven't seen that document as yet. So this reprioritization is about, guiding by the strategic priorities that we need to have the best possible crisis response with the resources that we have. And in parallel, the work is ongoing, as we've been discussing in this HNPW, about reforming the sector, reimagine how we work, and at the same time, shifting the power to humanitarian leaders in country and the people we served. Next, please. All right, so the recommendation that we give to the countries, or that we provide for the countries' consideration, is that building upon the good work that has been done as part of 2025 HPC based on the GF, 2 main criteria that the country can use as a starting point for this reprioritization. One is to define where the needs are the greatest. And again, this is based on the GF that I just explained. So the recommendation is that we should focus on the area or the locations that we see the intersectoral severity of needs at the level of 5 and 4, 5 being catastrophic and 4 being severe. So on the scale 1 to 5 of the GF, the reprioritization should be focusing on 5 and 4. And once we define the geographical location where this reprioritization should focus on, then we move on to what type of activity, the what part of the response. So the recommendation is that we should align with the strategic objective of the HNRP. And normally in the HNRP, we have one strategic objective on life-saving, which is the collection of multi-sector response contributing to this strategic objective. We are also aware that, protection being the collective responsibility for some countries, protection will have a dedicated strategic objective as another one, in addition to life-saving. So the recommendation to the country is that if the country has a dedicated strategic objective on protection, that should also be prioritized as well. So just to clarify that in the countries that do not have dedicated strategic objective on protection, it doesn't mean that protection is not reflected. It's normally embedded as part of life-saving strategic objective already. So with this recommendation, we should be able to identify within the people targeted as part of the HNRP, what is the number of people and where they are that we will reprioritize for this particular exercise. And based on that, we should also get the reprioritize or the prioritized financial requirement for the life-saving activities. Next, please. Next, please. All right. So as you are aware, this reprioritization exercise is still ongoing. However, we have received input from the countries, but not all of them as yet. So we have observed there's some observation that we made based on the input that we have received. First thing is to clarify is that this reprioritization exercise are not the revision of the carefully crafted HNRP that the country has already had difficult conversation last year in developing this. So this exercise is about identification of the most life-saving activities for the people with the most severe needs within the existing plan. It's not the revision. It's about identifying what can be reprioritized within that. And we maintain that the full fundings and the response outlined in this HNRP in the plan is still our objective as part of the GSO. And as there was some concern at the beginning of the exercise when it was launched that, this life-saving could mean different things for different people or different contexts. But based on the input that we have received so far from about 19 HNRP countries, and the analysis of over 700 activities under life-saving strategic objective, and if applicable, also the activities under protection strategic objective. These activities are not track and dump as might be perceived, because this is a full set of activities that contributing to life-saving and protection strategic objective. And these activities have a wide range of activities across all sectors, across all contexts, ranging from rehabilitation of water supply, for example, to temporary learning spaces or case management on child protection, GBV survivors. So all kinds of activities contributing to strategic objective 1 and, where applicable, strategic objective 2 within this reprioritization exercise. And last but not least, we heard concerns that when we start doing this reprioritization exercise, that there might be some risk that protection may be overlooked. But based on the input that we have received, we do not see that happening, because the recommendation that we gave to the country as well, that, protection should remain as part of this reprioritization, particularly in the country where you have a dedicated strategic objective of protection. And what we saw is that all countries that have dedicated strategic objective on protection include protection in their reprioritization exercise, and with some elevating it as a top priority or the top consideration. So this is based on the input that we have received so far. And as I mentioned, the exercise is still ongoing under the leadership of the humanitarian coordinator together with the humanitarian country teams. So we hope that, when we receive all of the input from all countries, we should be able to do a bit more analysis. But this is the preliminary observation that we have made based on the input we have received to date. That's it from my side. Thank you very much.
Thank you very much. I noted some questions, but so we move to IRC and WFP, and then we'll have the session for Q&As. They're also online.
Hi, Pep. Thank you. Hi, everyone. I'm Katie Grant. I'm Senior Protection Analysis Coordinator specialist from IRC. I think colleagues have just put a Menti link in the chat, but I know WFP colleagues and I wanted to take a moment to support a little engagement, acknowledging the expertise in the room and online. So if you can take a moment during my presentation to respond to the question around the value protection analysis has for the humanitarian community, we can reflect on that towards the end of my bit. But in the meantime, I think I'll pick up on some threads from Francesco and other panelists, since joining the IRC in 2020, in the days of developing the protection analytical framework, I think I've seen some progress within IRC and as a sector that we've made towards more collaborative, higher quality, more actionable protection analysis. I think Francesco has already mentioned kind of the progress we've made in terms of speaking the same language as a protection sector, as well as joint up efforts across subspecializations. Similar to the approach used by the clusters and AORs, at IRC, we have a process for joint up analysis as a violence prevention and response unit, informing safety outcome strategies, and have developed some tailored operational guidance, including how to best integrate subsectoral data sources, including safety audits, client feedback mechanisms, CPGBV, IMS, protection monitoring into protection analysis. And I think we're really seeing that now translating into better use of existing human, time, financial, and data resources. I think we've also made some strides in promoting more collaboration with the less usual suspects in protection analysis, including adapted resources by and specifically for frontline perspectives, as well as efforts to demonstrate path interoperability with other analytical frameworks to further that multi-sectoral engagement. And that's where I'd really like to focus my presentation today on IRC experiences with working with health, protection, and security stakeholders in protection analysis. I'm not sure if you can share my screen. I still see the Menti, but yeah, if you could go to the next slide, that'd be great, Emma. Perfect. And I think if you can click through as well. So from 2022 to 2023, sorry, Emma, if you could just go back to the last slide. Thanks. In an effort to improve respect for health facilities protected under IHL and improve access to healthcare, IRC joined forces with Johns Hopkins, Insecurity Insight, Physicians for Human Rights, and OCHA as part of a global ECHO-funded grant ending violence against healthcare and conflict. And this project was really focused on strengthening data collection and analysis on attacks against healthcare and its impacts on healthcare provision, as well as supporting and complementing different advocacy efforts to prevent and respond to violence against healthcare at different levels. This entailed operational research in several contexts. So the IRC led in South Sudan, in Syria, in Nigeria, and DRC, with a methodology that included a national survey to health workers and joint protection analysis workshops between health and protection actors, including with both health and protection clusters, to interpret the results, utilizing a slightly modified path, and then deciding on how to use them and position for specific advocacy priorities and channeling recommendations into the forthcoming HRP. In terms of the value add that we saw for this approach, I think that these contexts had really different expressions of violence against healthcare, from looting of healthcare facilities because of instability and socioeconomic factors, to kidnapping of personnel for ransom, to retribution of healthcare staff in light of a particular community member who had died in the hospital, all the way through to instances of direct targeting of healthcare facilities by parties to the conflict to maximize civilian harm. And by undertaking a protection risk analysis, by using protection risk analysis tools like the PATH, it enabled us to unpack and interrogate different types of violence and root causes to inform different theories of change and associated strategies. The data sources that were contributed by health, security, protection colleagues, including safeguarding in health, country data sets, WHO surveillance system for attacks data, situation reports, protection monitoring, that really enriched the analysis and supported gap filling and triangulation. And then the subject matter expertise in those joint analysis sessions helped nuance the finer points, but also really lent themselves to quite creative problem solving, leveraging the existing interventions and relationships that all of those different stakeholders had. So just a few examples. in response to analysis that was showing healthcare workers were more likely to be injured or killed when an incident occurred on the road to and from work. Stakeholders then planned security trainings and negotiation skill building with healthcare staff, with recommendations to develop a regional specific safe transport plan. To address some of the longer psychosocial impacts of violence against healthcare, stakeholders intensified the provision of post-incident psychological support services to colleagues who had directly or indirectly witnessed or experienced violent incidents. And then there were several advocacy-related priorities related to strengthening the legal framework to protect health staff, as well as recommendations to the humanitarian community to operationalize the rollout of the Joint Health and Protection Operational Framework. There's some links I can share in the chat, but I think if we go to the next slide, we wanted to just reflect on some of the factors that set us up for success with this. And I think for mostly dedicating the time to conceptual alignment and developing a shared understanding was really key, even though different sectors had different ways of talking about these risks. And I think something that really supported that was mapping of existing frameworks used by health colleagues, including the health cluster framework, the Levesque analytical framework, against the corresponding path pillar, and using endorsed terminology from those other analytical frameworks to really further acceptability. Finally, I think the exercise was really designed in a way to serve specific priorities that were already developed by the health and protection clusters, and they were timed in a way to coincide with upcoming advocacy events and strategic planning processes like the HRP. On the next slide, learnings from this project have also informed our current ambitions about how to most strategically engage with other sectors in protection risk analysis, including our current CETA-funded project where we're partnering with ACF to strengthen integrated protection analysis focusing on the food security and livelihood sector. And over the past year, we've completed some formative research with food security and livelihood actors on the existing state, on gaps, on needs and inspiring practices, which we've presented in another session during HNPW, which I'll link to in the chat if you're interested. I know my colleagues at WFP are going to be highlighting some learnings and opportunities related to engaging food security and livelihood actors. So I'll hand it over to them shortly, but I did want to just plug our upcoming plans to convene a task team to adapt some resources for food security and livelihood actors in the coming months. And we invite you to get in touch with us if you're really interested to engage in that work. And then finally, I'll go to the last slide and just share, I think, a few parting thoughts. I think as a technical person, as a protection analyst, we see the analysis is really only as good as who's taking it up. And where we think things are working particularly well, it's often because of personalities, relationships, leadership, commitment to seeing protection risk analysis as a priority in that context. I think colleagues have already spoken very well to, if this is seen solely as a protection thing for protection people at an interagency level, that's also trickling down to INGOs as well. And there's really a proliferation of different context analysis processes across sectors globally and within organizations, but not necessarily that top-down coordinated messaging around what is the defined purpose, where centrality of protection, risk reduction is that defined purpose. How are we doubling down on marshaling all relevant capacities and contextual information to really serve that goal? And I think that, there's been some thinking already around the centrality of protection aid memoir and associated benchmarks for HCTs. I think Ambassador Stillhart has also spoken to some thinking that the donor working group has been doing as well, which seems like a really good jumping off point related to accountability, but also leveraging kind of donor influence here as donor advocate and actor in terms of the weight that you give risk analysis informed intervention design and in deciding if interventions are funded or not, as well as access to humanitarian leadership. I'm not going to belabor the point on establishing a common language, but I think just reflecting on what this has meant for protection sector alone, this has taken time and really proactive dialogue to working with subspecializations around kind of that coordinated approach. And I think that dedicated time and concerted efforts still, has to be done with engaging each sector. And then finally, I think beyond multi-sectoral collaboration, if the goal is really locally led protection analysis and humanitarian action, a strategy is needed to underpin that goal. So how do we get from where we are now with the investments and the resources that we've given to supporting clusters leading joint analysis processes, to ensuring that local and national partners feel like they have the support, the capacities, the confidence to lead this going forward, with the recognition that I think the existing coordination system has not always been designed in a way that enables them to meaningfully engage. So how can processes enable area-based analyses and strategies to feed into those larger analytical and strategic planning processes? So with that, I will conclude my bit and hand over to, I think, colleagues with WFP who can also maybe bring up the Menti results.
Great, thanks very much, Katie. And I think what we'll do is I'll just go ahead and then hand over to Frederica, and then we'll do the results at the end if that's all right. So if you can share my the screen, yeah. So I just wanted to answer a bit of question that has already came up, which is, why should other sectors work on protection risk analysis, and what do we use existing protection analysis for? I mean, so firstly, as a food security actor, WFP doesn't work on responding to protection needs as such. So I think Francesco did a great job of kind of separating out protection risks and protection needs. But we do need to understand very much what the risks and the barriers are that are facing the people in the communities that we're trying to serve. And so that's why we both use existing protection risk analysis that's done by the sector and by other actors, but we also do our own protection risk analysis. We use existing pieces of work to inform our own context analysis in country operations, but we also use it as part of our secondary data review when we conduct our own analysis. And we also use that kind of risk identification and prioritization to direct us towards the most predominant risks in a particular context. So, I mean, we don't do our own protection risk analysis to duplicate anything that's already being done, obviously, and we would use any existing information as a starting point. And need to complement that by digging a bit deeper and getting a bit more granular information on exactly the type of barriers that are facing the individuals, the communities in the places we serve within the scope of the activities that we're conducting in those areas. So we kind of take the bigger analysis piece and then really try and dig down. So just to use that as a beginning. So essentially, there's three key reasons for why we do protection risk analysis in WFP. The first one is, as I mentioned, to identify risks and barriers and really to understand who's being left behind in our system. So who are they, where are they, and why are they being inadvertently left behind? So two just quick examples on this. For example, in Guatemala last year, they conducted an integrated analysis to inform their country strategic plan. The findings of that analysis highlighted some key protection and conflict sensitivity risks that we were then able to address in that operation. And to mitigate the risks identified, the country office developed a number of strategies. So, for example, they strengthened the community engagement and feedback mechanisms, and they adjusted the targeting approach to ensure marginalized groups were involved and participating and included in the approaches. And they also strengthened third-party monitoring and oversight mechanisms to pick up on some of these and learn more about what was going on. In addition, certain safety and accessibility improvements were made for some of the distribution sites, along with some conflict sensitivity assessments to complement what was learned. And that analysis conducted is going to inform the country's strategic plan that's going to be approved this year. In Chad, they did 2 similar pieces of analysis last year, based in one in the Lac province and another focusing on the Sudanese emergency situation. The one conducted in the East highlighted inter-community tensions in the areas that we're operating in, particularly around status-based assistance, which was being perceived quite widely as inequitable. So in response, the office there is developing a new response strategy and moving to transition from a status-based to a vulnerability-based approach. So just 2 quick examples of using that analysis to improve concretely the programming and the approaches. The second reason we do protection risk analysis in WFP is to support evidence-based decision making. So this is really in real time to inform both program adjustments and mitigation measures to make sure that we're reaching communities safely and equitably, and that we are doing protection mainstreaming. So a quick example here is in Sierra Leone. There was a lot of feedback coming in from communities based on analysis and based from other sources, that the food being served in schools wasn't appropriate, that the beans being supplied by WFP were very difficult to cook and they were unappealing to the pupils. So the school-based programming team there organized some community-based cooking demonstrations led by the nutrition staff. They started working with some volunteer cooks and the school staff and training them on instructions for different cooking methods, and they adapted the approach to the meal preparation. And this significantly reduced the complaints coming in. There were reports then afterwards of greater satisfaction and better attendance and engagement in school then due to that. Another quick example there is from Ukraine, where there was some cash-based assistance being delivered, but there was accessibility issues being faced by persons with disabilities. And so based on that, WFP introduced the home delivery of cash assistance through the National Post Service, which is available across all the regions of Ukraine. So this was to benefit any beneficiaries essentially with mobility challenges who didn't have IBAN accounts. And then they opened it up so that anyone benefiting from the assistance could actually choose their preferred delivery method. So they could choose between the National Postal Service or IBAN or Western Union during the registration. So again, kind of analysis and feedback leading to concrete changes in the programs. The third reason then that we do analysis is to ensure that we do no harm. So essentially to minimize unintended negative consequences and to avoid exacerbating vulnerabilities. So a quick example here is from Lebanon, where there were some issues arising around child labor in contracted retail shops. So WFP stepped up the number of referrals it was doing, including a number of children under age 13 to Child Protection Services. And then they worked with UNICEF to implement a national social and behavior change plan approach, which focused on child protection through training, through awareness, through policy enforcement. And it covered a number of stakeholders, and then they established standard operating procedures as well to guide the retailers in preventing child labor. And they also worked on a system to incentivize and to certify retailers for compliance with existing child protection standards. So just some quick examples there from our country offices. You can move to the next slide, Francesco. So how do we do it? Well, first of all, we consult obviously existing information as mentioned. So all of the available secondary data sources would include protection cluster existing analysis, ground truth solutions reports, any beneficiary perception surveys we can get our hands on. So anything that exists in, the sector-wide response that we can already look to. And then what we do is identify essentially gaps within that information or more granular information that we need to actually act on all of the risks and barriers that have been identified. So we both do standalone protection analysis and an integrated approach. So for the standalone, we do targeted protection risk analysis, which could either be in a particular region of a country or cover an entire operation or cover one activity area. These are often done when there are changes to the situation or there's a transition in programming approach. And then we also have an integrated approach where we conduct protection analysis alongside analysis of gender and conflict sensitivity. And this is done for multiple reasons, but really partly due to the lack of capacity in many WFP country offices to do 3 separate thematic analysis, especially because we have learned in the past that some of the findings lead us in the same directions, and especially some of the mitigating measures and recommendations tend to lead us in the same direction. So we brought these all together, and we first do a context analysis, which again would lean on existing sources, and then we do a risk assessment, which really gets down into the operational risks and mitigation strategies within our activity areas, within the areas of operation. So that's a bit of background, and then Frederica is going to give a couple of country examples as well. Thanks.
Thanks, Andrea. Good afternoon, everybody. I'm Federica from WFP in the Protection and Accountability team. Building on what Andrea explained, I just want to provide 2 concrete examples on how WFP in the past adopted programs based on protection risk analysis. These examples themselves are quite simple, but really demonstrate how crucial it is to focus on understanding protection risks and how, as WFP, a non-protection actor, we are doing it. So my first example is from Myanmar, where we saw firsthand how a comprehensive protection risk analysis improved programmatic outcomes. By triangulating evidence from protection risk analysis, but also from community feedback mechanism and monitoring data, the team in Myanmar identified a key gap in information provision. And in response to the analysis that was conducted, WFP launched a campaign to identify effective communication channel, standardized dissemination of messages, and we established long-term agreements with specialized organizations to speed up content production and ensure consistency with our messages. In Rakhine State, the Protection and Accountability team, working with the Sitwe field office and the cash transfer team, improved the messages on cash entitlements, leading to a significant reduction in complaint. So this is just a simple example to show how conducting a protection risk analysis using not only protection sources related to protection, but also community feedback mechanism and monitoring data led to a fewer complaints about assistance adequacy. And as a result, communities gained a clearer understanding on their rights and how to claim assistance and how to raise concerns. We can move to, thank you, to the next slide. My second example is from Lebanon. Back in 2023, UNHCR and WFP were providing cash assistance to refugees in Lebanese pounds only. However, due to the high inflation, liquidity shortages, this system created several challenges, including protection risks, like crowding at ATMs, long waiting times, increased visibility of cash withdrawals, especially for certain groups like women and the elderly. The team, together with UNHCR, conducted a protection risk analysis, and also in this case, through community feedback mechanisms and monitoring activities, these issues were flagged, and as a response, WFP and UNHCR introduced dual currency redemption, allowing family to withdraw their assistance either in USD or Lebanese pounds. Additionally, through the protection risk analysis, they identified the need to increase the number of cash redemption points and stagger assistance over several days, reducing congestions at redemption point and improving access. And through protection risk analysis that was then conducted following this change, this key programmatic change, the team noticed a reduced reduced number of protection risks and improved access. Also in Lebanon more recently, another example comes from the response to the Syrian influx. Initially, WFP focused the assistance to people living in collective shelters, providing hot meals to newly arrived refugees. However, after a protection risk analysis complemented by monitoring data, the analysis revealed that this approach was creating tension with the host community. So refugees living outside shelters were not receiving aid, which led to a perceived bias in assistance distribution. So in this case, the protection risk analysis actually informed the conflict sensitivity risk assessment. So the team decided to conduct a conflict sensitivity risk assessment to better understand what were the dynamics between the host community and the refugee who newly arrived. And these analyses together recommended expanding assistance beyond collective shelters to include refugees living in host community as well. So again, like a simple example on how protection risk analysis done with others influence and inform how WFP changed their programs. And if we go to the next slide, I just want to touch on some of the opportunities that we see moving forward. And some of the work that, as Katie mentioned, we are already doing with other organizations to improve the way we work on protection risk analysis. So first of all, there is already a lot of data available internally in WFP and in the food security sectors more broadly. For example, CFM, community feedback mechanism data, monitoring data, food security assessment data that we can use to enhance and strengthen protection risk analysis. So this is something that we are really trying to do internally, better use data that we already have to inform protection risk analysis. We are also working towards integrating protection consideration into our food security assessment to ensure a more holistic approach when we do food security assessment. We are working with the protection cluster to strengthening collaboration and to leveraging on the data that it's collected and it's produced by the cluster to inform protection risk analysis and to inform programmatic changes for WFP. And lastly, we're working closely with the specialized organization to help us refine our understanding of protection risk and improve the overall response. I just want to quickly try and move to the Menti if technology helps me, because I saw in the background that we received a lot of interesting responses. Shall I try and share my screen?
Please do, Federica.
Okay. Does it work?
Yes, if you can put a full screen.
Okay. So yeah, I saw a lot of interesting responses on to the Menti on why is protection risk important. So for better evidence-based programming, business continuity, create space for more context and qualitative analysis to ensure effective response and strengthen resilience of people in need and people at risk, to set the boundaries of what for humanitarian assistance, to prioritize response to critical needs and informed response. So I don't think we can go through all of them, but maybe this can help to start the Q&A. So with that, Francesco and Pep, back to you. Thank you.
Have at least 5-10 minutes for questions, comments. It will be interesting to hear also from you, from your experience and practical steps for integrating protection risk analysis into the humanitarian prioritization processes on financing decisions, response strategies, and how we ensure that humanitarian action response is responsive, efficient, and life-saving. So how protection risk analysis can be embedded better in other humanitarian sectors. Comments, questions? Not everyone. Yeah, please.
Thank you. I don't know if it works. Yes, it does. Well, thank you very much for all the presentations and the discussions. I'm not sure whether it's a question, it's both a comment and a question. I am a protection humanitarian worker, so eventually I'm very happy to see that we're moving in this direction for other sectors to really look at protection risks and to prioritize protection. But then the comment is that I see a lot about protection risk analysis, but we're not talking about protection outcomes and how the other sectors can actually respond to the protection needs, and how can we speak about protection outcomes embedded in other sectors' work and as part of the intersectorial work and collaborative work. So it's promising, but it's also concerning at the same time. So yeah.
Should we take more questions or? Yeah, please, Vicky.
Thanks, and thanks to all the panelists. That was really interesting. I just wanted to follow on from what you've just said, actually, because the thing that stuck in my mind a bit was how well are we doing in explaining how protection risks drive different types of needs? So not just protection needs, the ones you described, but food security needs, wash needs. What is the impact of those risks on all of those aspects of someone or a community or a household's lives? I think the work you guys have done in the GPC in recent years is really impressive. It's very good, but I think the next stage is that, and that would help us as protection specialists explain a bit more concretely, I think, to other sectors why protection matters to them as much as it does to us as protection specialists. So I don't know if you guys have any thoughts about that.
I also have a couple of questions, if I may. First, one to also other agencies and partners. I mean, when embedding protection risk analysis to your programming and you have to modify your programming, I mean, how much flexibility do you have to do that? I mean, I just come from Sudan, where food assistance is provided in sites where people is returning, and one of the obstacles to return is that there's no assistance in the places of return, where return is possible. So what is the flexibility? I mean, there is flexibility. To which extent there is flexibility for aid programs to modify according to protection analysis or protection reports? And also, thanks very much to Nassim from OCHA for the complete presentation. It has been quite a hectic process of this prioritization that we had gone through all the ICTs in the last weeks. I acknowledge that, I mean, countries, operations that had a specific objective protection, they were able to keep it. But I wanted to ask you how many of them, of the entire operations, how many had a protection objective and they were able to keep it? And what happened with your operations that they didn't have any standalone protection objective? Because, I mean, I saw in some that they ended up prioritizing other sectors and leaving protection only as mainstreaming, which is concerning too. I know and I acknowledge all the OCHA efforts to ensure the protection was not lost, but I mean,
Others? I don't know if Natini online, you want to answer to Pep?
Yes, sure. Sorry. And now my
Thank you.
camera is on. So apologies earlier. So in terms of the protection strategic objective, based on what we have seen in 20 HNRP countries that have published the document, I think more than half of them have a dedicated strategic objective on protection. And as I mentioned during my presentation that, if for the countries that may not have strategic objective on protection, it doesn't mean the protection is not reflected. I mean, I came from Ukraine, and I remember that when we did the HPC in 2023, we didn't have a dedicated strategic objective on protection, and it was in discussion with the cluster with the SCT as well, because protection is seen as life-saving as well, so it's already embedded in that life-saving strategic objective. So beyond strategic objective, I mean, when you're looking at the activities contributing to the strategic objective, either life-saving or protection, we see the list of activities are quite expansive. And for protection, I mean, as I mentioned before, that we did the analysis of the data that we have received, over 700 activities from all of the sectors that has been reprioritized. I mean, there's a list of protection activities are still there, and is also integrated into other sector intervention as well, as WFP colleague mentioned, or IRC colleague mentioned as well. So it is there and guiding the reprioritization exercise. And we are aware that some of the countries, the SCT also made the protection as a priority. It's already in the HNRP, and it's even more critical right now within this reprioritization exercise. Over.
Thank you, Natini. Just a reaction, very quick minutes, maybe to be provocative and building on some of the colleagues' question. I think that the current prioritization exercise is very effective, smart, and it's what we have to do in the short term. But then the question remains, because the protection activities that we have in the specific objective are related to answering to the need, but not to address the potential risks, not all of them. So the question is, I mean, building on, and that answer to those risks or to mitigate or to prevent is not an answer that just lies into the humanitarian action, but it lies within the next steps of the humanitarian action, but beyond. So the question for me, just being provocative, is okay, that beyond that prioritization and whatever categorization we give to activities in HNRP, how can we, I might go back to the question with another question, what can be the next steps? And I think that maybe that could be one of the focus on the current reset, or now we really use protection risk for those multi-sector action to reduce risk. Maybe it's convoluted what I'm saying, but it's a huge difference, because what we have in the HNRP is activity that has been designed to address humanitarian needs, not necessarily to go into the direction of preventing the risks that we see. So I think that there is much more we can do in the next months within the humanitarian reset to really look critically at the risks, where they are more severe, what are the priority, and you gather around different sectors, not just on the humanitarian side, but also different level to see how to address them. So I know it's a comment, question, and provocative thoughts, but just putting it out there. There is someone online. Oh, yeah. Please, Goretti.
Yes, thank you very much, Francesco, and thanks for all the presentations. Mine is actually to just share my displeasure that humanitarian operations can even dare think of deprioritizing protection, centrality of protection. Because when we take the protection from the core of humanitarian assistance, then what do we really have? What is our reason d'etre for being here? Because it's supposed to be protecting civilians, ensuring that they get access to services. But then it seems to me, and this misnomer, it really needs to stop. The people think that when we talk about protection, it is the exclusive mandate and domain of the protection cluster. We need to share this responsibility. So it's just to reinforce that point. And of course, to say that we are pushing tooth and nail over here in Cameroon to ensure that protection is at the core of everything we do. We've had to reduce our targets as we were advised. We've had to reduce our budgets, but a strategic objective number 2, we have a standalone protection strategic objective. So I wanted just to share that we need to really advocate and push for that. Over to you, please. Thanks.
Thank you, Reti. I realized there was one question on outcome that I think it will deserve an entire session, and I think is going to be an entire session. But maybe what I would say is, again, an opportunities, meaning that all our general coordination on the way we measure what we do lies in the humanitarian mechanisms. That is really much more geared towards measuring needs. So the efforts are on understanding how we can collectively measure those outcomes. So I think that we have two steps more ahead. One is what I think I commented before, that we really have to look beyond humanitarian action and multi-sector activities beyond just the humanitarian ones. And then attaching to that some element of measurement on how that reduce components of risks. I always say that it's impossible to measure the complete reduction of risks because it's so complicated and there are so many elements related also to HI violation. There are areas of it that cannot be fully measured, but I think there is a lot we can do, and maybe that could be one of the focus in the next. I think that's, I mean, my personal opinion, not GPC, I think it's shared, but is that that should be one priority moving forward. Probably the humanitarian resets can be another opportunity to look into that outcome monitoring. So sorry, I didn't answer it properly, but probably there's a reflection.
What is the are we close? Are we coming to a close? Or?
Yeah. You, Sarah. Yeah.
Okay, no, I just take the advantage of before you are closing to add one or two thoughts from my side. First of all, also huge thanks to all the presenters and presentations. Really impressive what we heard today. I think one of the challenges of the protection sector remains that our language is really very complicated. Already the word protection is a difficult word. It's a very difficult word. I used to work for a long time with the ICRC, and I used the word protection without thinking. Now I'm working for the Swiss Development Corporation, and when I'm in front of the Foreign Affairs Committee of the Swiss Parliament, I cannot use the word protection because they do not understand what we are talking about. And this may be anecdotal, but I really think it's hugely important. We need to be really careful how we talk about some of these activities that we are carrying out. And I quite like what I heard from the protection cluster, that we are talking about risks, because this is already a word that is better understood outside of our bubble. And it is really important that we, the times when we can talk to each other in the bubble, these times are over. They should have been over for a long time, but now they are definitely over because we need to go out there and explain to the taxpayers why are they giving money, why they are giving us the money. For them, it's much easier to understand why, food distribution, WFP, it's kind of very easy to understand, and it is much more difficult to understand some of the issues that we are discussing today. So let's watch our language very carefully. And then secondly, I can only just I like to echo the question that you asked, or that I think we also discussed briefly or touched upon about protection outcomes. for me, the best definition of what protection is all about, it is preventing and putting a stop to violations of international humanitarian law and human rights law, and addressing the consequences. So if we have a good analysis of the risks, and in one of your slides there was an analysis of risk that kind of then ended up in what are the 5 top risks in a country. Excellent. And what we then need to see is how are we addressing these 5 risks? What is the strategy that we are applying to address these 5 or whatever 3 to 5 top risks? And I think this is back to the responsibility of a humanitarian country team, of the humanitarian resident and humanitarian and resident coordinator, that we do have solid strategies in place to address these risks, and that we do not lose ourselves in everybody doing their own little thing, and there is absolutely no joined up action that would actually increase the influence of humanitarian actors on a selected number of risks that we consider are the top risks, and then also have the courage to say, okay, there are plenty of other risks, but we now, given the resources that we have, are focusing on those that are the 5 top risks. So a good analysis to drive us towards meaningful protection outcomes.
Was like a good preface for the closing remarks, but Sarah?
I think it was the closing remarks. Thank you. No, thank you to everybody. I think this has been a very important, timely, and constructive discussion. I know that many of you have contributed to put protection risks and protection as through the reduction of violence in focus of humanitarian action. Many of you here, many of you online, and presenters. So thank you so much. And I think actually it is a good point to the conclusions, because I've been asked to talk about practical steps moving forward. And I think this is definitely one, looking at using the protection analysis to identify priority risks and the wished for outcome. And from there, design a response over sectors that can reduce the risks and reach the protection outcome that we wish for. Not only in the humanitarian sector, but even beyond. And there I think we as donors has an important role to look to what other actors, human rights actors, peace building actors, development actors can actually intervene for us to reach certain protection outcomes. I think that's a very important point to make. And thank you to also our OCHA colleague for making the point and reassuring us a little bit that as of now, protection has not been cut out from the reprioritization exercise. I think that's, for me, a very concrete thing to follow up on. I think it would be really useful at one point to see which contexts have kept protection and even put it maybe as the main priority. I think looking at what donors can do, maybe those are contexts that needs a little extra push to really show how we can move this agenda forward concretely. Finally, I want to do a little point that I think we didn't discuss that much. I discussed it a lot in the corridors. But in the current situation, I think it's important for humanitarian actors to look at how can we pool the funding, the resources, and what are the functions, not which organization, which agency, what are the functions that are needed within the humanitarian system now to ensure that we have those important protection risks analysis. And I think that would really be a request, I think, if possible, for a future discussion. I think it would be extremely useful for us as donors to understand now what are the critical functions that are needed to make sure that we have the essential risk analysis. So with that, I think I close the session. Yeah. And wishing you a nice day and good continuation on our collective discussions. Thank you so much.